Africa is vulnerable to disease burdens and lags behind other continents regarding access to vaccines. Pharmaceutical manufacturers have been discussing strategies to increase vaccine manufacturing in the region.
So we need to sell the concept of why a federation is going to be important as a voice amongst policymakers, right? So that's one side of the equation.
Currently, Africa produces 1% of the world's vaccines. In their strategy by 2040, the association hopes to have grown to 60%, and here is the strategy.
You know, the African Union has set us a goal to make 60% by 2040. It's a very, very challenging dream. We can get close to it, for sure, but we need to work very closely together. The other thing I think which is very important, which often is not talked about, is the fact that every president now wants a vaccine facility in their country. It is not possible. It will not be sustainable.
The Association for Pharmaceutical Manufacturers says to set up a vaccine manufacturing plant, one needs $50 million, but the ministries and the policymakers must be engaged to get market for the vaccines.
Because vaccines have no private market. You know, they're either bought by UNICEF, by Gavi, or by the government, right? And so, because when there is no private market, you have to have assurances that if I'm going to put 50 million in a facility, I better have some, orders in advance for 10, 15 years, right? So that's what we're going to discuss here.
Kamana Ivan Walnyolo, NTV, in Entebbe.